technology.
Yeah, Mr. Praveen, you wanted to say something. I saw you venturing ahead.
See, of course, if you look at the third wave, right, so now I think one, of course, from a skill set perspective, everybody aware that, we need a greater skill set development across all the segments, starting from a general public to the medical professionals. There is a greatest level of upskilling and infrastructure development is required. But what I realized with the fantastic data points that we have collected over the last two, waves of pandemic, now we are driving some intelligence. For example, when it comes to ambulance positioning in Bangalore itself, we know where is a large chunk of requirements were coming using our intelligence from the back end. Like as a technology platform, it gives us an opportunity to track that, bring some intelligence on the platform. Although there is a connected ecosystem, there is some amount of artificial intelligence that can be driven in order to anticipate some of the changes. For example, government is anticipating the region should be locked down. So rather than that, we can use some intelligent data to make sure that how can we position healthcare services and products in such a way we don't really hit that scarcity that we have faced in earlier two waves. I think the real intervention of technology is the need of the hour that I feel. As all panelists said, the platform integrated healthcare ecosystem plus a technology intelligence is the most important thing that is required to handle not only the third wave or even the further pandemics or any other natural disaster to happen.
Yeah, excellent. To wrap up, I think now, if I may just one line from each of the speakers here, you are engaged deeply with emergency healthcare services. If you were to pick one area which is of immediate priority and area of focus for you, one line from each of the speakers, and we can wrap up with that. Starting with Mr. Praveen.
Well, I think the one area is how we can use technology, because we believe with beautiful technology together, we save more lives. So technology is a go-to thing for me.
That's what you'll be focusing on.
Yes.
Anything in particular in technology?
Of course, technology as in today we have web technology, but it's more of intelligence, predictive healthcare, predictive analysis is what we'll be focusing going down the line with the data that we have so far.
Predictive analysis. Mr. Walia, what will be your focus now on emergency healthcare services and preparedness for the coming wave?
Yeah, I would be
hope we don't have, but your preparedness.
I would be looking at that we should have a centralized command center which is technologically very upgraded, so that it has updation from each district, that when the pandemic bursts out, the people, they don't know which hospital to go, which hospital has beds. So this is a chaos.
Okay, very true. Yeah,
we would look like to upgrade through a public-private partnership, centralized command center.
Dr. Shetty, your priority now. I know there are a number of things.
Yeah, but for me, I still believe that one of the most critical elements in this whole piece is the skills. So skills across all categories of people, whether it's doctors, nurses, emergency medical staff. I think that remains one of the biggest lacunae and what we need to truly work on. And all of us really need to put our heads together to see how we can get more and more skilled people, because that's what will finally have an impact on outcomes.
But excellent. Dr. Venkatamana, your comments in terms of this and we wrap up.
A large country with a large population should not be taken as a burden, and it should be taken as a biggest resource. So we have the huge amount of resources. I feel each one of them pointed out, every point is very important. I would like to focus that we have enough number of resources, but we do not know where they are. I think we need to pool the resources, identify the right resource for the right purpose, and to utilize the resources optimally to the best effect. We need the guidelines. And the guidelines has to be uniform across the country. Unless that is done, we'll be misusing the resources and we will again still be complaining. So I feel we should have pool all the resources together when it comes to the country as a single country, when it is an emergency. And then we must have the guidelines across the country uniformly. Then we will be able to do the best for the nation at large.
Excellent. I think we have heard of disease surveillance. You're talking of now resource surveillance as well. I think very important.